This health promotion presentation is about heart disease and stroke by Christina Rutten. So, the biggest significance to kind of bring up is that heart disease is the leading cause of death in the United States. I think what's even more important to note is that it's really prevalent here in rural West Virginia. Stroke is the fifth leading cause, according to Healthy People 2030. So, pathophysiology, heart disease, stroke, those two really go hand in hand. Heart disease in general is kind of an umbrella term, but plaque, it causes the arteries to narrow, which then decreases the amount of blood flow that's actually able to get to the heart. So then you have like heart attacks and things like that, things that you do not want to occur. A stroke, when the brain is unable to get blood flow or a vessel bursts, you just, and again, that's kind of the narrowing of the arteries and things like that. Things are unable to get, if you can't get the blood to the heart can't pump the blood and the oxygen, and, that's where we end up with heart disease and stroke. So this is important to know. How do signs and symptoms present? Especially with heart disease, you can have chest pain, heartburn, nausea, shortness of breath, palpitations, fatigue, swelling. And, with heart disease, swelling can occur in any part of the body. However, the most common places are around the eyes, bilateral lower extremities, and the abdomen. So it's important for patients to weigh daily to kind of keep an eye on this, especially if you've already had some type of diagnosis already. How do signs and symptoms present with a stroke? Think fast. Face, arms, speech, time. So when you think fast, you want to think, is the person able to smile? And when they do you notice any drooping? Is it symmetrical? Can they lift their arms up evenly? Sometimes one arm might drift. When they talk, is their speech slurred? Time is really of the essence, and it's really important to call 911 immediately at the first signs and symptoms of a stroke. But one really big thing that people don't think about is noting the time that the stroke occurred. So if you or a patient is having signs or symptoms, go ahead and make that note. You're going to want to give it to EMS or some type of medical professional. Screening, heart disease, blood pressure, cholesterol, weight, glucose, physical activity, diet, asymptomatic carotid artery stenosis. You do a screening with this, but fortunately, usually you do it when a patient is symptomatic. It's not typically recommended by the USPSTF 2018. According to them, it's not recommended for asymptomatic individuals. Cardiovascular disease risk screening, electrocardiography. So with this, it is usually recommended for adults who have intermediate to high risk for CVD events. And, a lot of people think, why blood glucose? But for those who are type 2 diabetics or just diabetics, it usually places them at a higher risk to develop heart disease and stroke. So with a stroke screening, you have all the heart disease as well. Plus, you want to do atrial fibrillation checks and just stay on top of that. Let's talk prevention. So, healthy food. And it's important to get involved with your health care, exercise, maintaining a healthy weight, no tobacco, also no alcohol. With healthy food, we're looking for low saturated fats, low trans fat, high in dietary fiber, and some omega-3s, But you really want to kind of do that because keeping that cholesterol, if you remember back, it causes the buildup of plaque in the arteries. Maintaining a healthy weight, keeping that BMI where it needs to be. You can check with your local, your PCP, and they can give you that. Exercise 30 minutes to an hour a day. 30 minutes is, the minimum, but really an hour would be preferred. And when I say getting involved in your healthcare, nobody's a better advocate for somebody than yourself. So getting involved, making sure you're doing labs, and following up. Don't always count on other people. So with West Virginia, there are some local and state agencies. I looked up on the West Virginia DHHR, and they were able to provide me some resources. The West Virginia Department of Health, Cardiovascular Disease Program, Wise Woman, American Heart Association with West Virginia, WVU Heart and Vascular Institute, St. Mary's Regional Heart Institute, West Virginia Health Right, and another one that's not on there is Raleigh General Hospital. It is a stroke center, so it's good to have these known and written down if you were to ever need them, especially if you are at high risk. What have we learned? So, what are 3 symptoms of heart disease? What is the acronym for stroke, and what does it stand for? And what should you make note of when noticing signs of a stroke? I'll give you time to answer.